Plasticity is both a good thing and a bad thing, though, as well. So it's being very mindful of the fact that, if you do enhance plasticity in the brain, it has to be then shaped in the way that you want it to be, because you don't want loads of extra plasticity and then an individual to their psychedelic therapy and then go out into the world and start doing all these things, these behaviors that are actually detrimental.
Hello and welcome to the Mindfulness Experience podcast, an official Wonderland 2023 conference media partner. I'm your host, Keith Fiveson. Today we are thrilled to have Dr. Amy Reichelt, a renowned neuroscientist and diet and brain function expert. Dr. Reichelt joins us to discuss her talk at Wonderland Conference and the neuroscience of psychedelics. She'll be exploring neuroplasticity mechanisms and its potential use in treating neurological and neurodegenerative disorders. Welcome, Dr. Reichelt. Hi.
Hey, good to speak with you, Keith.
Can I call you Amy?
Yep, that's perfectly fine.
Amy, I am just so excited that you're here, and I know you've had a really busy morning, and we've had to go ahead and coordinate this, but it's really so important that you're at this conference, and the work that you're doing is so important because it's really helping to advance the area of neuroplasticity and the area of psychedelics, and really helping people to go ahead and show up. So I'm wondering if you can tell us a little bit about your talk and what you'll be talking about at Wonderland. I know you'll be talking about something about designing the future self, which is wonderful because for me, that really means sort of envisioning who you are and then moving into the space of actualization, right? It's where have I been? Where am I now? Where am I going? And then using, the tools at hand to do that. So maybe you can jump into that a little bit and I'll stop talking.
So the panel that I'll be speaking on is about really how we can, as pharmacologists and neuroscientists, and also working with medicinal chemists, to be able to really generate these next generation of psychedelic inspired molecules that have the potential for greater safety, greater efficacy, greater durability of improvement for individuals who need these medicines for mental health and neurological health conditions. So we're going to be talking about innovation and how we can use these as tools for the betterment of human well-being, really around the therapeutic design, dosing regimes, how we can design these molecules that we have closer control over the safety margins, so they're more accessible for people who may potentially have reasons why they might not want to engage in taking a psychedelic drug in its classical sense, and to be able to use these as a platform moving forward for a next generation, really, of drugs that are broadly able to enhance neuroplasticity, and that this has both the ability to improve quality of life for individuals who have mental health conditions, knowing that disorders such as major depression have a component which is really underpinned by the reduction of neuroplasticity, but then also in potentially also neurological disorders or neurodegenerative disorders where individuals are, the brain is basically experiencing stressors inside the brain as opposed to external environmental stresses, and that we've seen from really exciting neuroscience emerging that these molecules have powerful capacity to both propagate synapses, so the connections between neurons, to grow new neurons, and then also to start to quash the inflammation that is also set in place by so many conditions that not only predispose individuals to neurodegeneration, but also just from lifestyle and aging itself. So there is the potential there for so much great discussion.
Yeah. Well, as a 68, soon to be 68-year-old man, I can appreciate the whole idea of cognitive function, and also looking at society and looking at what's going on right now. There's really systemic trauma, and I do know that with trauma, individuals have a very hard time, especially if whether or not it's post-traumatic trauma, post-traumatic stress disorder, or ongoing trauma. They have a very hard time being cognitively functioning, really accessing their prefrontal cortex or their hippocampus, and they're on fight or flight mode all the time. So you're talking about also, more importantly, the research around psychedelics without the hallucinogenic aspect to it. And I'm wondering, is that sort of as a what the research is around that and the benefits around that, if you're looking at psychedelics without the hallucinogenic quality, and really what happens, from a neurological perspective for individuals where everyone's familiar with SSRIs, and we know nothing's really changed in that area. 50% of it, the efficacy rates aren't really that high. So I'm really wondering your thoughts around this, and what this actually means in terms of the benefits.
Yeah, I think that it's such a contrast with the established pharmacological treatment of mental health conditions at the moment, importantly with these psychedelic therapies. And we're really just starting to understand how they can not only be harnessed to treat psychiatric conditions, but also now for their potential in neurological conditions. So as you were saying about SSRIs, I mean, one of the key aspects is that these drugs don't work for numbers of people, but potentially their efficacy is down to an increase in neuroplasticity. But it's much weaker than we can see with studies looking at psychedelics and the 5-HT serotonin 2A receptor agonists, that they are able to propagate this very widespread increase in cortical plasticity.
So this whole neurogenesis, the whole interconnectivity of the brain versus the numbing of the brain, is what I'm hearing you say.
Yeah. So, and I think that there's really, it's two parts of a whole. So we have this hallucinogenic capacity of these drugs, and that hallucinogenic capacity may be ideal for individuals who are going through these deep-seated traumas and reasons to unwind how they have come to these psychiatric conditions, and that's obviously really essential when then integrated in with the psychedelic assisted therapy. So in the integration sessions where you're working with your therapist, who can start to delve through these thoughts and feelings that may have been undercovered and pushed away into the deep into the psyche, and these have becoming re-emerged in your brain. And in neuroscience we say that there's a phenomenon called reconsolidation, which is where you take a memory that's already been instilled and consolidated into the neural networks of your brain, and then it becomes activated again through the process of reconsolidation, then new information can be built into that already established memory. And then that can influence your behavior going forward. So you have a very traumatic memory full of emotion, but it's that reframing of the memory and understanding that plasticity is essential for that entire process of reawakening the traumatic experiences or the memory, and then also consolidating with new information put into it. So there's that aspect that I see as being essential with the potentially with the hallucinogenic drugs, the psychedelic drugs. However, there's still evidence that the plasticity process is that really key element, and that if drugs are working without that hallucinogenic capacity, but still invigorating neuroplasticity mechanisms, then that creates a way that people can potentially utilize these newer drugs without that hallucinogenic effect, that they can take in the home, that there's a more chronicity. They don't have to go to a specific center or doctor to be administered those drugs. There's increased safety, and people will be able to have that increased exposure to them. And also for individuals who potentially have a history of psychosis or family history of psychosis, which would be not allowed, as they're excluded from taking these drugs, that would open up the field to allow those individuals to be able to take these drugs without the risk of psychosis or loss of reality that is so important for drug developers to be able to really harness.
So it's so funny because, and it's wonderful everything you're saying, because I got a couple of images in my head, which is sort of like, the idea of trauma being implicit or explicit, and how much trauma is implicit. So we have the emotional feeling to it, but we don't have the narrative and we don't have the words. So it's sort of like a ball of thread, right? And what I hear you saying is the ability to quiet down the default mode network, allow the individual to go ahead and do some deep work, or at least understand what their traumas are, to get some narrative around that, and then to take that thread and to sew something different, to sew a different story, a different narrative, so that it's more explicit, so that that individual can then accept themselves, be present to whatever their present story is, whatever their narrative is, and then use that non-hallucinogenic as a way to just be present, and to go ahead and be buoyant during their day, and to go ahead and face the world in a different way. Does that resonate with you in terms of my feedback? Did I get it right?
I think that we understand now that plasticity is both a good thing and a bad thing, though, as well. So it's being very mindful of the fact that if you do enhance plasticity in the brain, it has to be then shaped in the way that you want it to be, because you don't want necessarily loads of extra plasticity and then an individual to have their psychedelic therapy and then just go out into the world and start doing all these things these behaviors that are actually detrimental.
Hugging the gas station attendant.
But and I also think around like the default mode network as well. I mean, there's research now. I know that it's very closely involved in mind wandering, and that it's obviously from studies that with neuroimaging that have shown that there is this taking the default mode network offline a bit more. But I see the default mode network in the brain as being really important. Like it's a switch between the salience network and the attentional network, and so it's also a very plastic network in itself. So it's important in terms of that it's exercised in a way that you switch constantly between different networks of the brain that are important for your daily function, and that if your brain is stuck in one mode, too much, and it's, you know, like a muscle, it increases, hypertrophies. So you know, like when you see tennis players and they've got one arm bigger than the other because they exercise that side so much more than the other. But it's the balance, it's getting that back into homeostasis and having, you know, a more even playing field in the brain, and, you know, being able to use these neuroplastogens, psychoplastogens to rebalance aspects of neuron networks, and build up those networks that may be hypotrophied. I don't know, you know, the ones that are less exercised, and, you know, trying to restore that into the brain.
Right. So what I hear you say is certainly, you know, and I've heard people talk about the default mode network sort of as our ego center, right? You know, it's the area that really helps us to manage and control our lives in a way that, you know, we can function in the world, right? And then, you know, what I hear you saying, it's okay to take that offline, but you need that. You know, you may need that offline to go ahead and do some deep work where you go into your subconscious mind and you start looking at what happened to you when you were 2 years old or whatever, you know, but you need to come back and you need to then have that reframe, as you said, which then allows you to integrate or activate the changes that you see in, you know, through the medicine. You know, and I'm wondering, you know, when you look at psychedelics and this whole area of, you know, neuroplasticity and the brain, you know, how is that going to possibly lead to treatments for this neurological or neurodegenerative disorder area? I mean, is it like microdosing? Will people need to take, you know, a little bit every day? You know, what are your thoughts around that? Because a lot of people might think that, you know, this is just another SSRI. You've got to take it every single day. You know, this is something that, you know, it's not like one and done. But I'm just wondering, from your view as a because as a psychedelic assisted therapy provider, I'm very focused on the structure of the setting and, you know, the integration and the activation areas. I think it's okay for psychedelics, certainly for some folks in a sacred environment or however they're using them. But, you know, the safety and the efficacy rates are very important from my view. So how are we going to use these psychedelics to go ahead and help individuals change their lives? And what are your thoughts around, you know, the structure around that specifically?
Yeah, it's something that I think about so much of the day, in terms of being able to understand how, you know, a neurodegenerative disorder is set up and in the brain. So that I think of that as being, you know, it's a continuous process, that it's not just going to be halted through medication. It's, you know, as it stands, the importance is that, you know, we can have these neurodegenerative conditions, they're ongoing, and medications are coming in, and the function of the medication is to either start to reverse damage that has been done, or to, you know, stop damage going forward. And with psychedelics, I can see that their utility would be in boosting plasticity that may help with compensation around, you know, damaged circuits, damaged neurons, you know, helping the brain to adapt and rewire more rapidly to be able to compensate for damage that has been set up. As I was saying, that they have this incredibly potent anti-inflammatory capacity. We need to do still more experiments to understand whether or not that, you know, extends into the brain in as potent a way as previous studies have shown, particularly in, you know, peripheral tissues. And again, a lot of those studies were conducted, you know, in tissues and cells and mice. Whether or not those actually then do translate through to humans is important. I would like to see in terms of my own personal preference, I think it would be great for individuals who have neurodegenerative conditions or neurological conditions that these are detected early, and it's a way of like halting the further progression. And it could be that you have your dose of your psychedelic inspired drug every month. It may be a 6 month treatment, in the same way that people are having certain treatments with biologic agents. You go into a clinic and you have your infusion. I think learning a lot from how the new Alzheimer's drugs have been useful as well, in terms of the amyloid, the pathogenic amyloid pathologies that are setting up. Again, these are infusions where people are going into a clinic and having that. And I would hope that there would be the option that even individuals don't have to go into a clinic, that these are things that can be administered at home, because I think it's that provides the accessibility for individuals further.
So it sounds to me like more like and I use this term a lot, the reboot, reset, reframe, the opportunity to go ahead and clean out the cache, go ahead and rewire, the brain, really allow the brain to refresh itself, have a little bit of a reboot. And then, that in and of itself might be enough for the individual, rather than numbing themselves on an ongoing basis, really. Now, when you say, when we start talking about inflammation, one of the things that comes up for me, and certainly that's going to be one of the big topics of the conference, is the whole area of longevity, and the whole area of looking at dead cells within the body, looking at refreshing the body along that line. Are we thinking that there is an opportunity here? And you've mentioned Alzheimer's, and dementia, for that matter, might be looking at these what are they called? Not alien cells, but they're called exactly. What? Say that again.
Senescent cells.
Senescent cells. Yeah, these are the dead cells, pretty much so, right? Zombies. That's it. The zombies.
The zombie cells.
Right. So there is this idea of being able to flush those out, and being able to have, regrowth and reconnection within the brain. Is there some hope around that in terms of longevity, and in terms of, your view? When I hear inflammation, that's automatically what I think of, because a lot of aging is around inflammation.
I think that there hasn't been any studies yet really linking psychedelics and the presence of these senescent cells in the brain. But from my knowledge around aging and diet, nutrition, there's a real push towards flushing out these senescent cells, or zombie cells as people call them, because they're just wasting space effectively. They're just there and they're not contributing, and so it's important to try and not have those present in the body. And I see it really as being like almost a garden, that you don't want these like dead weeds taking up space, or dead leaves all over the floor, just stopping what's below having nutrients and sunlight to be able to nurture new growth.
Right.
And I see it as that you could really harness both the anti-senescence and getting rid of these cells, which I believe from some of the protocols that I've seen around them is sort of almost a monthly protocol, where you take various supplements or treatments that can start to get rid of these cells as they accumulate generally. So taking those and then having fresh pastures almost to tilled soil ready to grow new.
You're using all of my analogies here. I've got our life is like a garden. You've got to put down a lot of manure. You got to dig it up, make sure you use it as fertilizer. Then you got to seed, feed, weed, and grow your garden, and you got to continue to do that. So, wouldn't that be great? And sign me up for that monthly cleanse. I'm
Yeah, and then we can think about psychedelics as maybe being like Miracle Grow. They're the fertilizer. We've already got the
love
neurons
that.
there, but helping them to sprout new connections. Or in the case of in the hippocampus, there's been studies, at least in mice and rats, that have shown that neurogenesis is actually enhanced by the treatments with DMT in particular, and you get this birth of new neurons that are really highly plastic and ready and willing to integrate themselves into new neural circuits and encode new memories. So I think that that's obviously really important, and thinking about psychedelics as being something that can invigorate those processes, but to clear out the mess beforehand just allows things to work that much more efficiently.
Right. Well, I've added Miracle Grow to my to my analogy, and to be able to flush the garden and to be able to go ahead and reinvigorate it with a little bit of Miracle Grow on a monthly basis. I love that. That's really great. But I do see, and I'd like your focus on this, your view on this, because what we're talking about is still very, it's very controversial in a lot of areas, and I know there's a lot of challenges, that need to be addressed. What do you see as some of the, challenges that do need to be addressed, and how are we going to how are we dealing with them? Because I do want to recognize. Roland Griffith just passed on. He was an amazing man who really spearheaded a lot of the work on Johns Hopkins in terms of research and development. And, he's actually helped normalize a lot of the acceptance in this area. But, what is your view of some of the challenges, to use this monthly, if you will, if I went back to that grow, what are the challenges that individuals face? Because we're at a very crucial time in terms of the Renaissance, in terms of the growth. And I do feel that we're not far away from mainstream, but we're still not there. Can you give some perspective on that?
Yeah, I think one of the main challenges is really faced at the moment with the clinical trials, that we're trying to run rigorous clinical trials with these compounds that haven't been really clinically investigated in this kind of way. So it's almost like the standard for a clinical trial to be accepted by the FDA is a different format to which these drugs are able to provide. It's like the issue with blinding. So a gold standard randomized clinical trial is that there's double blinding, which means that neither the investigator nor the patient subject who's volunteering for the study knows what treatment they are receiving. But if that treatment basically functionally unblinds itself due to its inherent properties of being potently hallucinogenic, you have no blinding. And it's almost like then FDA, who are, in the way, the gatekeepers to allowing these therapies and drugs to become mainstream, have to reevaluate based on like a whole different playbook. So it's a rule. It's like playing two different games. So their FDA is used to playing basketball, but we're coming in and being like, oh hey, so this isn't going. Yeah, we're going to play baseball, and it's very complex in that way. And also
so let me get clarity on that. So what you're saying is that the playbook, if we will, if we're using that game analysis, if the playbook for psychedelics that have a hallucinogenic quality to it is different than the playbook that would use psychedelics without that hallucinogenic quality, and that both of them are double blind. So, but there's a different thing that we're looking at specifically with the non-hallucinogenic quality than we are with the hallucinogenic quality. Did I get that right, or help me to understand that a little bit more?
In general, just looking at, I mean, if we think about the psychedelics without the hallucinogenics, they won't suffer from the same blinding issues as the psychedelics with hallucinogenic capacity. The issue is at the moment that our FDA is tailored towards medications for approval of these clinical trials. These medications tend to not have hallucinogenic capacity. Right. So what they're looking for in terms of their gold standard of a clinical trial cannot be reflected in a clinical trial conducted with a classic psychedelic or ibogaine or ketamine, for example, because of this inherent property that they will induce hallucinations. And therefore, how do you blind that in an individual? There's been various, niacin as a placebo, or giving people, just negating how you want to.
So you're clearly hallucinating. You're clearly in that process. So how are you going to double blind that? It's you can't, is what I hear.
Yeah, and I think that means that the classic psychedelics. I mean, the research that's been done with for example, compass pathways is the most far down the line of with their synthetic psilocybin. They're really paving the way. And they're like pioneering how to run these clinical trials with these hallucinogenic drugs, because they're facing all the challenges along the way, because they're meeting with the FDA and the FDA is saying, oh no, you've got to do this. And this is the standard that we're looking for. And that's been a really big challenge, and means that it is in fact also slowing down how rapidly these drugs can, even with breakthrough potential, get approved then to allow general access to them through prescription. So I think it's really like going into a new frontier. And importantly as well, it's that you've got the blinding issues, you have the drug itself, how currently, if they're being investigated for mental health disorders, that you have such a robust therapeutic aspect to it as well. So you're seeing improvements even in the placebo group, because again, they're getting such great support in terms of the integration sessions and meeting with their therapists. And I think that even with studies of Mike Bolgenscholz's studies with the alcohol use disorder and psilocybin there, that again, you're seeing improvements in both groups. So even your control group is showing improvement. So
well, you've got two therapists on, the requirement is for two therapists in the room. I mean, that is, in and of itself, having that kind of attention and having that opportunity to go ahead and work through whatever issues you have, you'll see some improvements. But I think your point is well taken, because I don't know how sustainable, the FDA has these requirements for two therapists in the room, a certain amount of number of sessions before, after, so on and so forth. But when you get down to the one therapist, how are you going to afford the treatments for these, especially when you have 6 hours in some cases, if you're, depending upon what you're using, ketamine an hour, psilocybin 6 hours, MDMA 4 to 5 hours, exactly, so how do you negotiate these things? And I think there's got to be a more stable more stable way of doing it. And I think your point being is that that's slowing down the efficacy rates or the acceptance rates, and the legalization quality. But yet at the same point, we do have that huge stigma where you've got a large part of society that still thinks that these are evil. Never the mind that ibogaine is now shown to, help with opioid addiction. Or, there's Kentucky has put $42 million into a study. There's a whole bunch of stuff that we can kind of point to. But these are real ethical considerations, deciding, what other kind of ethical things do you see kind of in this particular space that really need to be looked at? I talk about the structure of the medical model, but yet at the same point, we do know that once we start taking a look at, MDMA was fast-tracked. We're looking at hopefully legalization at the beginning of this next year sometime. But at the same point, there's a whole underground market, and there's still not a lot of education around a lot of this. So I'm wondering what your thoughts are around that, because, I'm on an Instagram account. If I put anything out there on psychedelics, suddenly I've got people who are friending me that are selling psychedelics. Like that's weird. It's just strange.
Yeah, totally. And I think that, some of the ethical considerations really lie in the accessibility when even these, hopefully, FDA approval, just the cost to insurance companies. Like, will insurance companies actually support the cost of these treatments? Because, as we were saying, there was so much involvement of in terms of the time involvement of the therapists and individuals having to be present. That's a large burden price-wise on somebody's, when it comes down to their hours. And then if it only becomes accessible at these very high prices, will insurance companies support them? Beyond that, for individuals, potentially veterans, will their insurance cover their therapies? Or will it just come down to, again, the insurance company looks at it, goes, well, you have major depression, maybe just try this other antidepressant, and or you have huge chunks of money that you have to co-pay to support these new modalities of therapy, which again, what if people don't have insurance?
Right.
Because you can't work, because you've been, crippled by PTSD, or depression has led to loss of job and other ailments that prevent you from accessing healthcare. I think that's a major issue, and I think it's one that's going to be addressed in the forefront in Australia at the moment, where the down scheduling of MDMA and psilocybin has definitely, brought to attention the potential for their use.
Right.
But almost that the infrastructure wasn't ready for that change. And even though, they had months to start to establish, but, this is, again, Australia is a country where they have a very established, public health system, but they still have private. These therapies are going to be private, not taken by, how do you get Medicare to cover that?
Right. And we're talking about plants here, we're talking about things that grow, things that you can grow in your backyard. Like, give us some education, give us some, protocols, give us some opportunity to go ahead and test what we get. If we, go ahead, if somebody else sells it to us and we go ahead and we don't know specifically what we're getting, give us the opportunity to test it. Give us a understanding as to how we can keep our kids safe. Give us, all of these things. I think we can get buckled down so much with these, with the infrastructure. I do believe that individuals who are suffering from trauma, I'm a vet, And, I'm a member of the Heroic Hearts Project and, as a healthcare ambassador. And I do believe that we should be treating our vets here in the US or onshore, not have to take them down to Costa Rica or Jamaica or down to Peru or wherever. What kind of safety or efficacy are they getting there? Obviously, we do look into that, but why should they have to go somewhere else? Why doesn't the healthcare system recognize that, 1, 2, 3, 4 treatments, you don't need to go ahead and take the SSRIs all the time, and you can cure PTSD. So it's, there's a lot of stuff that's going on, and I'm really just hoping that we can move beyond that in terms of treatment. Now, I do want to ask you about something that's weighing. I've been wanting to ask you because I know that you're really very much focused in terms of the whole idea of diet and brain function. And I'm wondering, as we start to take a look at psychedelics or these entheogens that really help to open up the mind and open up the body for connection, what the impact of specific diet might be on the individual, whether or not they're male or female, and whether or not that plays a role as well for the individual in terms of what their outcomes might look like.
Yeah, my research prior to entering into the psychedelic space, I was a neuropharmacologist and behavioral neuroscientist, and my academic lab, we focused on how diet affects the brain. And it all really rooted around changes in plasticity again. And in a similar way to psychedelics and other pharmacological agents, food itself, and in particular, how our modern day diet with these, ultra processed foods, high in fat, high in sugar, how that has a detrimental effect, not just systemically across the body, but also in the brain. And one of the key aspects of my research was that high sugar diets, in particular where liquid sugar is consumed, like,
Alcohol.
Drinks, and not even alcohol. I mean, when we look at it, it's, this is what kids are drinking in terms of
a Diet Coke or whatever, Mm-hmm.
Yeah, these sugar sweetened beverages, because there's such a high concentration of sugar that in its liquid form basically is able to evoke numerous physiological changes in the body. And one of the key aspects was that it's reducing neuroplasticity in the brain, as well as also increasing inflammation in the brain. And these two go hand in hand to impact on cognition, particularly around systems in the brain that are essential for decision making, attention, our executive functions in the prefrontal cortex, and also our hippocampus, which is the memory center for encoding new information coming in and forming these new memories. And critically, what the research and my research contributed to was that these ultra-processed foods are terrible for our brains, but they're cheap and readily accessible by so many people. And if you're busy and don't have time to cook, or can't cook very well, or don't have access to fresh food, that these are there, and this is what people consume. And that we know that reductions in neuroplasticity and increases in neuroinflammation go hand in hand to predispose individuals to mental health conditions like depression, anxiety, also potentially increasing risks of neurodegenerative disorders and dementias. So when we think about with psychedelics, that people do have these changes to their outlook, but in that stage where the brain is, again, plastic, this window of plasticity is being unlocked by your dose of psilocybin, being able to feed the brain then, and the body with nutrients that it needs and craves to be able to provide it again with the best possible environment in which to reap the benefits of this enhanced plasticity, be it, having high omega-3s, which we know are essential for making our neuronal membranes fluid, and that allows the process of changing and increasing receptors in the neurons, or making new dendrites and synapses. So we need that.
Right.
And I think that some of the shifts in people's mentality that's so important that happens during these psychedelic therapies needs to be married with that holistic health, that nutritional knowledge of what you should be eating, how this can help providing people with the tools and the knowledge to be able to make those changes as permanent as possible, and also integrating in movement and exercise. We know that aerobic exercise is great for increasing BDNF. We also know that psychedelics increase BDNF, but it's essential for neuroplasticity. Right. And by then having these shifts in perspective, that an individual who's suffering from major depression, just for them to be able to get up in the morning and go out for a walk and eat a healthy breakfast, eat healthy foods. And I feel that the psychedelics are that catalyst that starts this process, but it's a process. It's not just a one and done. Your treatment's over, everything's fixed. It's not like that at all.
Right. So there's this whole idea of setting, integration. Somebody goes into look at using psychedelics to go ahead and help them with some trauma, or go ahead and help them realign or reset themselves for a change in their life that they want to commit to, or they want to just actually work things through, if you will. They need that time. But to go through it, there's like that rubber band effect is what I'm hearing, is if you go through it, there is that, and you go back to eating bad food, whatever you're eating, and you go back to the old behaviors, then the impact of the benefits aren't there. Really the opportunity is, as you noted, when you're in that neuroplasticity moment, to be able to reset, reboot, reframe, and then activate those reframe, that reset that you're looking for, that reboot that you experienced into your life. That's so important. And food has a real play in that. And essentially what I heard was also sugars, whether or not that's carbohydrates, simple carbohydrates, or whether or not it's simple sugars that you might find in, drinks, or even in some juices, which are, I couldn't believe in some of these little wonderful little juicy things that our grandkids get. They come up and I say, well, how many grams of sugar in there? And they say, 12 grams. I said, 12 grams in a little container? I said, no, 12 grams is, that's three teaspoons of sugar that you've gotten there. We're not, so it's everywhere, and it really does impact and throw us offline, and really cloud the brain and cloud the cognition, as you say. Let me ask you, as we start to wind down here, I'm wondering a couple of things. I'm wondering, what you see as the future of psychedelic research and where you think we're going. Obviously, you'll have your panel down in Miami at the conference, and we talked about the relationship between the diet and the brain. But also, in your own life, this is the mindfulness experience. I came into psychedelics through my practice of mindfulness. I tried psychedelics over 50 years ago. I have had that in my life over the years to go ahead and reboot, reset, reframe, and give me perspective. And here I am today. I do believe in a fully comprehensive lifestyle, which really incorporates mindfulness. Do you have a practice, a mindfulness practice of yourself for yourself. Maybe you can share that, and also before that, obviously talk about where you think we're going, if you're okay with that. And I do want to get to how people can get a hold of you and find out about your research as well. So a lot there to unpack. Sorry.
Okay, so future, I feel like there's going to be, a lot more in terms of, accessibility to psychedelics, but also I hope to see clinics becoming mainstream that aren't just you go in and have your therapy sessions and your psychedelics, but you have that support network around you as well of this is integrated into you have lifestyle advice as much and coaching and support systems really there, and even having those educational seminars to be able to empower people to when they're involved in this is a much more holistic care setting than just going in having an infusion, or going in having your psychedelic therapy and then you're required 2 integration sessions afterwards, be it one immediately afterwards and one via Zoom. It's having these much more encompassing clinical spaces. And what really excites me as well is around neurotech and how there is so much emerging awesome neurotechnology that can not only enhance plasticity itself but start to diminish neuroinflammation, altering inflammation in the body, and having that at hand as well to be able to be accessed by individuals to again assist with plasticity, shape that plasticity in the appropriate way for them. So be it that somebody, you could use transcranial stimulation or TMS, magnetic stimulation, where you're really altering the function of the brain at its most core level, and understanding using functional neuroimaging as well, where the brain is potentially hyperactive or hypoactive due to the condition that an individual is experiencing, and then using both the psychedelics as the catalyst to get the plasticity underway, but then using stimulation techniques to shape it further to prolong the durability of the treatment, and having people being able to do these things in their own home, I think is really important as well. And for clinicians to be able to then track the use of these devices as well. So
remotely, to have this sort of lifestyle modification aspect of being able to, as we sort of started, designing, the visualization, being in the simulation, flight simulation of your life, and then being able to actualize it. Wouldn't that be kind of cool? If everyone could afford it, though. And what about your own mindfulness practice? Do you have a practice yourself that you use?
Yeah, so I love to do yoga. I find that that's very sort of grounding for me, as well as being outside in nature is one of, again, a really key aspect of mindfulness for me, just being able to expose myself to the elements and nature and see what's around, and not be listening to a podcast or music or sat in a car, just be really just walking and moving. I'm a fidget, so I find just that very still meditation difficult, but I definitely think that there's yoga and movement and integration of mindfulness within that.
Breathing practice.
Exercise, and being able to really engage in strenuous exercise where you are just entirely focused on your breath and what's going on, and your somatic feelings within your body is incredibly important to me as well. And I've been practicing a bit more with again integrating in neurostimulation through TDCS device which incidentally,
What kind of a device is that? What is that?
Transcranial direct current
Oh,
stimulation.
okay, all right.
So it's also stimulating default mode network
Mm-hmm.
while engaged in sort of a calm, meditative environment.
Are you using lights, or are you using a cap, or what are you using there?
Sort of a headband.
A headband, okay.
Yeah.
Okay.
And also I found it seems very strange, but soothing would be binaural beats. I find have been incredibly helpful in focusing more at work. Just, when you have that deep work mode that you have to like settle into, definitely found that the gamma frequency binaural beats is in a way of helping your brain focus by again sort of engaging those appropriate networks, getting the gamma frequency oscillations going, and really helping to make yourself productive, and then being able to shut off.
That's great. That's great. So let me ask you, Dr. Reichelt, or Amy, if you don't mind, but let me ask you, how do people get a hold of you to find out more about your work and about your research and about what you're up to?
Yeah, so my website is cognitionnutrition.ca. I work at Pure Minds Neuropharma as their Chief Innovation Officer, so I'd encourage you to look at what we're doing on our website at Pure Minds. I'm also on Instagram as, I think, nutritional_neurosci. I don't Twitter or X or whatever that is anymore. But yeah, I can be reached at my website, and yeah, it's been really wonderful talking to you today as well.
And we'll make sure we put those websites in the show notes so that we've got everything and people can get a hold of you. I want to again thank you so much for being here, and I know a lot of things have gone on today, so thank you very much, Amy. Yeah, really
no worries. Thank you again. It's been a delight chatting to you.
Thank you, Dr. Reichelt, for joining the Mindfulness Experience podcast and for sharing your insights on the fascinating topic of the neuroscience of psychedelics and its potential use in treating neurological and neurodegenerative disorders. We're thrilled to have you speaking at the Wonderland 2023 conference, and we encourage our listeners to attend the conference using the mindfulness code mindfulness20 for a 20% discount of the registration cost. We wish you all the best in your future research endeavors, Dr. Reichelt, and for everyone else, stay mindful.